Good morning. This is Jean Eaton, your practical privacy coach and practice management mentor with Information Managers. Now, just a reminder, I'm not a lawyer and I don't play one on TV. These are my recommendations based on my experience and research and not legal advice. Is a custodian allowed to view patient information on NetCare when the patient is not under their care? No. That's kind of a full stop there. So under the requirement or the agreement that you have with Alberta NetCare, only users that have access to Alberta NetCare for the purposes of providing a current care relationship with the individual who's the subject of the information and providing a health service to that person can have access or can have authorized access to NetCare to be able to look up patient information. So the patient doesn't have to be in the same room as the healthcare provider when you're looking up that information, but you have to be providing care to that patient. So it's in that current episode of care. So you have seen the patient and you order tests and you want to look up what the test results are. That's an appropriate use of NetCare. If you do not provide original care for that patient, then you should not be looking up test results for that patient. So very clearly, a custodian is not allowed to view patient information if they're not currently providing care to that patient in NetCare. Now, this is really interesting. I continue to get this question, and I'm really glad that I get this question. But it's also a really good reminder for me to be able to share with you that I get this question all the time. So people aren't understanding the question or the answer, or they need regular reminders. And we also have new people coming into our clinic on a regular basis. So I want to share with you, don't forget to tell people about the rules of when they can and cannot access NetCare. If you've been in the clinic for a long time, this might be old hat for you. You're way past this type of information, but not everybody else is in the clinic. So it's important that you understand that you still have a job to do about telling people what is appropriate to access NetCare and when it is not. So make sure that you have informed the custodians and everyone else about when they can access NetCare, and do it again. And when you think you've done it enough, do it again. Make sure that you have documented what training that you have provided to people so that they clearly understand what they can and cannot do, and make sure that you've documented their attendance at that training. They need an oath of confidentiality, and this is a great time to be able to include the wording about NetCare use and agreement to follow the rules. Now, a lot of custodians will push back to say, well, I don't need to sign an oath of confidentiality. I'm a physician or a chiropractor or a pharmacist. I know what my rules and responsibilities are. Just because they say they know isn't enough for the business of a clinic. The clinic needs to get their affirmment or their agreement in writing in their oath of confidentiality and in the training attendance to document that they attended the training. Because if a physician or a custodian continues to snoop on your clinic EMR or your Alberta NetCare EMR system, then the clinic can say, he should have known better. We provided the training, he attended the training, he said that he understood the training, but still continued to snoop, looking at patients' information that they were not providing services for. So as a business, you need to get that documentation to be able to confirm that you did all your reasonable steps as a business, so that if you have an employee or a custodian who continues to snoop and access records when they should otherwise know that they don't do that, then you can demonstrate that you've met your requirements. So when there is a privacy breach and that there are notifications or discipline that needs to happen, then the individual can't say, I didn't know that. So that brings us to the next piece. When you do have a privacy breach, like somebody has been snooping, you need to be able to refer to your internal discipline procedure. So that means that you have to have an internal discipline policy. So what are you going to do if you can identify that somebody has been snooping in your patient records? You need to make sure that you've got a discipline procedure that applies equally to everybody who has access to those records. So whether or not it is a physician, a front office MOA, a billing person, or a vendor, if they're looking at patient information when they don't have the appropriate authorization to do that, when they've been snooping or otherwise maliciously accessing the information, what will be your discipline procedures? You have a reportable privacy breach, so you now need to notify the Alberta Minister of Health and the Office of the Information and Privacy Commissioner. And if that privacy breach is involved in Alberta Netcare system, Netcare portal, you need to notify the Alberta Netcare Compliance Officer. And you might also need to notify the patient. You do need to notify the patient. So these are the things that you need to do if you have somebody who is snooping in Netcare. And we always need to remind our custodians and affiliates and our vendors about what is the appropriate use of accessing patient information on Alberta Netcare portal and your internal patient records information. This is Jean Eaton, your practice management mentor and practical privacy coach. If you like this episode, please subscribe to this channel and add your honest feedback to the comments below so that people who like what you like can find this podcast.